For us, this wasn't just another coding project. It really started with a question we saw causing so much panic all around us. How do you find life-saving blood in an emergency, like right now? Our answer is GeoPlasma. It's a system we built to do just one thing: connect donors to patients, instantly.
And this quote, this really captures the single biggest realization we had. You know, building an app is one thing, but engineering a lifeline, a system that absolutely has to work perfectly when everything else is falling apart, that's a totally different challenge.
This was the question that honestly kept us up at night. When every single second counts, how do you cut through all the chaos? How do you connect a patient with a donor who might be just around the corner, available right at that moment? This really became our mission.
But before we could write a single line of code, we knew we had to understand the chaos. We had to really map out every single failure point in the current system, the system that families are forced to navigate during their absolute most vulnerable moments.
And what we found were 4 critical gaps. First, these acute shortages, especially during those golden hours when it matters the most. Second, just the sheer chaos of manual coordination. Families making hundreds of desperate phone calls. Third, a total lack of real-time visibility. Nobody knows who has what, where. And finally, the false hope you get from unverified social media posts, which so often lead to frustrating dead ends.
The really frustrating part is that people are already trying to solve this. You see websites and WhatsApp groups everywhere. The intent is definitely there, but the impact just falls short. And why is that? Well, the data is almost always outdated, there's zero location intelligence, and there's absolutely no connection to the actual live inventories and blood banks. They're just good intentions with no real power behind them.
So, to fight this chaos, we built GeoPlasma. It's a single, centralized platform designed for one purpose: to bring order, speed, and, most importantly, reliability to this entire broken process. So, how exactly does it work? Well, we built it around 5 core strengths. We've got location intelligence to find the nearest possible donor, real-time availability, so no more wasted calls, automatic eligibility tracking, which is crucial, instant one-tap contact, and something we took very seriously, a privacy-first design to make sure everyone involved is protected.
We boiled the whole thing down to just 3 simple steps. A donor registers, a blood bank verifies their information, a patient searches and connects. That's it. It's seamless by design, because we learned early on that in an emergency, complexity is the enemy.
We absolutely obsessed over the user interface. We designed every single screen to reduce panic, not add to it. That meant minimal clicks, super clear information, and basically zero cognitive load. Because when you're in a crisis, you just don't have time for a learning curve.
Okay, so now let's go under the hood a little bit. Because building a system this reliable wasn't just about adding features. It was about solving some really tough technical and logistical challenges along the way.
Our tech stack was pretty straightforward, actually. Standard web tech for the front end, Python with Flask for the back end, and we used Render for hosting. But for the database, we made one very deliberate, mission-critical choice. We went with SQLite.
So why SQLite? Well, in a crisis, you just cannot afford to lose data. We kept thinking, what if our server restarted? We had to know that every donor registration, every single update was completely safe. SQLite gave us that rock-solid data persistence in a really lightweight, zero-configuration package. It was a technical decision driven entirely by the life-or-death requirements of the mission.
The core logic of our database is really built for 2 things: speed and safety. This filtering logic you see here is designed to do one job in milliseconds: find an available donor with the right blood group in the right city who is medically eligible to donate right now.
But the toughest hurdles weren't always about the code. They were about real-world unpredictability. How do you handle a massive traffic spike during a citywide emergency? How do you truly protect a donor's privacy? We even had to dive deep into medical policy to build in things like the mandatory 90-day donation cooldown period. That's stuff you don't learn in a computer science class.
So, after all this work, what's the real impact? What does this actually mean for a family in crisis? Let's take a look at the numbers we're projecting.
We're looking at a 60% faster response time by totally eliminating the manual phone chains and instantly connecting patients to the nearest available donor. We can drastically cut down the time from request to connection. And in a golden hour emergency, those minutes literally save lives.
We also expect an 80% reduction in the administrative burden on hospital staff. I mean, think about it.
By automating that initial search, we're freeing up nurses from making hundreds of phone calls so they can focus on what they do best, patient care.
And this one is perhaps the most important. We truly believe a system like this can double the number of active donors. When the process is simple and you know your donation is going to have an immediate, local impact, so many more people are encouraged to step up and help.
And really, this is just the beginning. Our roadmap is all about making the system smarter and more accessible to everyone. We see a future with a mobile app for instant notifications, using AI to predict demand spikes, direct integration with government health databases, and full multilingual support to make sure that absolutely no one is left behind.
Our core philosophy has always been this simple phrase: technically simple, socially powerful. GeoPlasma isn't about flashy, complex technology. It's about using robust, straightforward tools to solve a fundamental human need and to bridge a critical gap in our community's health infrastructure.
It really leaves us with one final thought. In a world of incredibly complex algorithms and massive platforms, what if technology's best and highest use is actually much, much simpler? What if it's just about connecting one person who needs help with another person who can give it, instantly and without any friction at all?